Hi guys, Dr. Cervone here with Cumberland Chiropractic and Sports Medicine. It's week 2 of our neck pain series for this month. Last week you saw Dr. Moore talk about lateral neck pain. Today I'm going to talk about posterior neck pain. And I'm going to show you how in our office we address joint, muscle, and nerve to treat the same problem, posterior neck pain. So stick around. Okay, so today we're talking about posterior neck pain. So when I talk posterior neck pain, the first thing I think of is what is causing pain back here. Most times we see it in our desk workers or somebody that works a job where we're very front dominant, kind of rounded forward shoulders, our chin's protruded forward, we call this anterior head carriage, and things just on the front are just tight and contracted, and that's putting a lot of tension on everything in the back, the muscles, the nerves. It's putting a lot of stress on the joints kind of at the bottom of our neck where it meets our thoracic spine. So if you've ever carried something, you want to carry it close to your body. It's easier to carry something, it's not as heavy when you have it kind of supported with your body close. If you're trying to hold something further out with your arms extended, it feels heavier, it gets harder. And that's kind of the same thing our spine is doing when we're sitting in this slump forward posture, head forward. It's putting a lot of stress on this part of our spine because it's out further and all the muscles are working harder. We want to be more upright and straight. It's going to make our neck just not work as hard and not put as much tension on those structures. So what specific structures are we talking about that have this chronic tension on it? And what are these specific structures, what does the pain feel like when there's a problem with those? We're talking about the big trapezius muscle first and foremost. It goes from the top of the skull over to the shoulder, all the way down to the low back, so in this big kind of triangle region. And it can cause a lot of tension in that when the head's forward, when the back's rounded out, when the shoulders are pulled forward, we're kind of tugging on it from every one of those corners of the triangle there. And if we pull that muscle away, underneath of it, we have even more layers of muscle. And the other thing that we see chronically tight in a lot of people is this levator scapula muscle, which runs from the top of the shoulder blade up to the neck. And same thing, that's just going to get a lot of tension on that when you're head forward posture, when the shoulders are rolled forward. And those things are stabilizing your shoulder blade when we're in this bad posture, instead of these lower trapezius, rhomboid, kind of lower back muscles that should be pulling our shoulder blade down and back. This trapezius and levator scapula muscle are pulling up on it, rolling it forward, and it's kind of destabilizing that a little bit. So that's going to be long-term a problem we need to fix and stabilize the scapula to get this stuff fixed. The other thing we're going to see is chronic tension on nerves as well as muscle. And one nerve we see all the time is this dorsal scapular nerve, which kind of runs down between the shoulder blades. So if you have like a burning pain that comes from the neck down between the shoulder blades, we hear that a lot. I got this numbness, burning feeling between my shoulder blades. It could be this dorsal scapular nerve that's just getting chronically tugged on, chronically inflamed because we won't give it a break and we're just tugging it forward constantly. And it could be Velcro down to one of these muscles that we talked about before. These two muscles could be stuck together. There's a lot of different scenarios we see where these adhesions, this scar tissue stuff is sticking things together, and we need to release that to release your pain. Okay, so we can treat these problems, we can get you feeling better, but how do we completely get rid of them and keep them from coming back? We need to fix the problem in the first place, which is that kind of forward posture stuff. So we want to get a little stronger in the back. We can do some specific rehab exercises and stretches to do that, to stabilize the scapula, to pull them down and back, to get us up a little straighter. But the other problem with this is we need to fix these bullies in the front. We need to release these tight, short tissues in the front of the shoulder, the chest, and in the anterior neck. That's what next week's going to be all about. Dr. House is going to be talking about the anterior neck pain, the anterior neck tissues, and how we treat those to fix even posterior problems as well. This has been Dr. Cervone with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.